I have it right here with me as well. It says SPF 30. I've always had this question about SPF values. Doctor, since you're here, can you share a little bit more about SPF?
Sure. So SPF stands for sun protection factor, and traditionally it is referenced as such. So if you have a product which is SPF 30, when applied correctly in a laboratory setting, for example, it's measured at 2 grams of sunscreen per centimeter square of skin, which I'm not sure, in real life, many people do that at all. Then you are 30 times less likely to get a sunburn. However, there are other factors involved here. Of course, we know that different skin phototypes, they have different thresholds for getting sunburns. So what's probably more valuable is the idea that SPF 30 actually blocks 97% of the sun's harmful ultraviolet rays from reaching the skin. So the other factor to consider here is that we do need to reapply sunscreen. So every 2 to 3 hours is what is generally recommended. But if you are doing water sports or you are sweating a lot in an outdoor environment, then you may need to reapply it more frequently.
Now I know. So after hearing your explanation, it seems like Victoria's regime is comprehensive enough in prevention and also protection against all the spots that we've been chatting about.
Yes, so I think what Victoria shared is, a very good sort of review of what's doable in terms of scientifically backed skincare regimen. So we've talked about the effects of cumulative sun exposure. So not just what you're exposed to last month, but several years ago. And the fact that if you start preventive skincare with these antioxidant ingredients, with a tyrosinase inhibitor like thiamidol, you can actually delay the onset of these dark spots, which in a lot of individuals is genetically predetermined. Some people develop melasma, which is triggered off by fluctuations in your hormones. And even individuals who develop scarring, post-inflammation, hyperpigmentation from acne scars, from dermatitis, or even a mosquito bite, any form of inflammation can lead to pigmentation scarring. So having a skincare regimen like that actually makes your skin more resilient in terms of being able to naturally, utilize your body's physiological processes to get rid of this excess melanin that leads to hyperpigmentation.